Good afternoon. I hope you're all doing well. Afternoon sessions are sometimes a little bit difficult. So I hope to keep your interest. And over the next 20 minutes, I hope to inspire you to consider some of the possible implications of trauma in relation to psychedelics. I'm a clinician specializing in complex trauma, and I work as a clinical lead in criminal justice mental health services and as a consultant in trauma-informed practice. No affiliations to the psychedelic field, and I work extensively in trauma-informed care, including as part of accreditation processes for organizations. And I'll start by giving a little bit of context about trauma-informed practice to say that it's a non-clinical model, it's a non-pathologizing approach, and effectively it's the application of a trauma lens in every aspect of organizational processes and environments. So it is frameworks that support organizational change. They're part of organizational culture, but by no means a theoretical exercise. It's very much a skill set, practical skills, decisions and actions aimed at increasing safety and empowerment. In trauma-informed practice, survivors have a very substantial role. They are involved, they lead on developments. And the well-being, empowerment, and inclusion of workers is as important as that of service users. Trauma-informed services find that they have to deal with less safety-related incidents. The service users engage better, they tend to have more positive outcomes, and to retain those outcomes for longer. There's also evidence of increased resilience, not only for individuals, but for organizations as well, in terms of sector-wide pressures. So what is it that we actually do in trauma-informed services? Well, we do a lot of work to identify triggers proactively and also to equip people in terms of how to respond to them. And we work together with survivors to identify and mitigate re-traumatizing factors. Behaviors are always sought to be understood through that trauma lens, so as potential adaptations to trauma. And especially behaviors that may be aggressive, demanding, withdrawn, inconsistent, or ambivalent. And being trauma-informed is not really something that comes to an end. It's not a tick box exercise, but it's a constant process of evaluating and improving services. So, why do I think we need to think about trauma perhaps more than we already do in the psychedelic field? You know, obviously MDMA and psilocybin for PTSD are the flagships of the current developments. But I would invite you to think of trauma as something beyond PTSD, which is a very specific diagnosis, and until very recently the only one. Historically, trauma has been missed, minimized, undiagnosed, misdiagnosed as other conditions, especially mood and anxiety disorders. And it significantly underlies other conditions such as eating disorders, treatment-resistant depression, psychosis, and substance misuse. Even if we were thinking only about PTSD, we're still talking about millions of people. But when we approach it from a different perspective, the question that the World Health Organization asked a few years ago, how many people have experienced at least one significant traumatic event in their lives, the surveys showed that it could be as much as 70% of the population across different. So if we also ask the question who is attracted to psychedelics, we may want to consider that a lot of us who are interested in this field for healing, meaning, or perhaps to work in the field, we may have diagnosis that is or isn't trauma-related. We may have made conscious links between current difficulties and past experiences, but we also may not have conscious memories of traumas that may have happened in our lives, especially at a very early age. And if there is anything to learn from other helping professions, then we know that we could also need to consider individuals coming to work in the field as potentially having higher rates of adverse childhood experiences and trauma themselves. I invite you to consider trauma not as types of particular events, but on the basis of the different elements that are shared among traumatic experiences. So these experiences physically overwhelm our nervous system. They take away our control and agency, the choice to change what we're experiencing. and they also tend to be unpredictable and therefore impossible to prepare for. Not everyone that experiences trauma will be affected by it in the long term, but a lot of people are. And that impact can be quite pervasive. I'm only going to point a couple of things here, such as self-defeating narratives setting in, risk-taking behaviors, chronic pain, and chronic health conditions. If you're taking one thing away from this talk, is perhaps to remember that the impact of trauma always affects a person's ability to feel safe. So survivors may feel unsafe in their own bodies, so the body becomes a source of trigger. And they may also feel unsafe in relation to other people, and that includes interactions with professionals. But I also argue that the impact of trauma is also always spiritual, in the sense that it shatters trust on some level. And that could be trust towards another person, people in general, or the solidity of the physical world, as in this photograph here of a bridge that collapsed. It tends to shatter hope, cause disconnect and isolation. So I'm suggesting that survivors are seeking meaning as much as they are seeking relief from their symptoms. And that is a responsibility for all mental health practitioners, but in the psychedelic field, there is perhaps a more prominent responsibility around that, because psychedelics come with this promise of hope and connection. The impact of trauma can be quite long-lasting. It can lower the kind of baseline resilience that people can have to day-to-day stressors. And there's also an established link between existing trauma and the risk of future trauma, including the risk of likelihood of PTSD together with future traumas. A reality for many survivors is that the systems that were meant to support and protect them often re-traumatize them, and sometimes do so quite significantly. And that is when these systems are not paying attention to imbalances of power. So thinking about where this may be relevant in psychedelic provision, we would want to think about spiritual suggestibility, practitioners unintentionally imposing their own beliefs on clients, including beliefs about psychedelics, and also at the other extreme, thinking about predators, thinking about spiritual abuse, which is part of what happens where there's vulnerability. Also, predators are attracted. Of course, psychedelics have been shown to have the potential to be wonderful allies in recovery from trauma, and they can do that by allowing a person to examine what's happened without being overwhelmed, by reducing the intensity within which our internal mechanisms protect us, and allowing different perspectives to emerge so that a new narrative can come about that explains or at least gives some kind of meaning to what happened. Part of that would be bringing in and inviting back home self-parts that may have been feared or rejected, and these are parts of the self that often hold a lot of shame and guilt. Psychedelics also have a rather unique ability to work with the trauma that's stored in the body quite directly, and that's a particularly tricky part of talking therapies. And as mentioned earlier, they can bring a lot of hope and meaning, which are the things that trauma takes away. However, and I need to clarify that I'm not suggesting that all challenging psychedelic experiences are traumatic. But when challenging experiences are overwhelming and they take away that sense of control and agency for the person, and they have a long-lasting impact, then yes, I think we need to be brave enough to ask whether these have traumatized people. And these are some reflections to share from a trauma lens. So the first thing that we would consider if we were becoming trauma-informed would be what kind of triggers can we possibly predict? And we would be thinking about triggers that may be inherent to the psychedelic state. So perhaps physical things that may happen, such as physical weakness or immobility that some people experience, nausea or pain, that for some people may echo abuse that they have experienced in the past. We would be thinking about some of the contextual factors, like people lying down in quite a vulnerable state with blindfolds in darkness, And also we would think of kind of factors that are more adjustable and are more open to interventions. For example, the proximity of other people. In some retreats, people are asked to kind of lie down very, very close to each other. We know that when survivors are activated, they actually need a lot more physical space from other people. And very important, they need to have the choice to move away from other people if they feel unsafe. And again, I will say that every person's experiences are completely individual, and for some survivors, that physical proximity may actually have quite a containing and nurturing effect. Unpredictability in itself is one of the top things that survivors say are really, really difficult for them. So we work to make our services as predictable as possible. And quite a bit of thinking would need to go into that in terms of psychedelic experiences. Boundaries, quite a subject that deserves a conference in itself. But I would say that boundaries that are not clearly agreed beforehand, that are arbitrary, inconsistent, or don't make sense can be particularly harmful. And some of the language or concepts that we use around defenses can be a bit problematic. I recently read in an article that psychedelics attack defenses. And I was interested in that combative language because as a psychotherapist, I honor defenses. They are mechanisms we have that have allowed us to survive and function well enough to get to this point. So from a therapeutic perspective, we work to build a different relationship to those alliances. We don't look to kind of barge in and take the door down. So people have at times said that they felt quite defenseless, thrown into the psychedelic state to look at their trauma without having at least a buffer. Other things that we would need to consider is what happens when memories that the person is not aware are activated, what happens when people are not sure if memories of abuse are real or not, and what happens when some insights are not helpful, but they're rather confusing. Can they lead to a destabilized sense of self? Can they destabilize relationships in the person's life that perhaps were not perfect, but were good enough? So you may be thinking, okay, well, part of the trip can be challenging for a lot of people, but then there is a next stage where there's more hope, there are useful insights, there are ways suggested by the medicine to go forward. Again, that doesn't happen for everyone, and some people are caught up in this looping effect, where they're revisiting traumatic material again and again without any obvious benefit. And perhaps they are unable also to useful narrative. So going back to those self-defeating narratives, one of the things that many survivors consider about themselves is that they're too broken to be fixed. So how do you make sense of a psychedelic experience that was meant to be helpful, that was meant to help you move forward when it hasn't had that effect? And what is that like if you are part of a retreat or perhaps a sharing circle where everyone else has had a really meaningful, connectful experience and you're the only person that got stuck in darkness? So we cannot really understand trauma if we don't talk about shame. Shame directly correlates with self-harming behaviors, and it is also one of the key factors that people drop out of therapy or they find it very difficult to make progress. Last month, there was some research published that looked at psychedelics, psilocybin specific findings was that it's particularly difficult to predict what will happen to shame as a result of psychedelic experiences. So the majority of participants had a small but significant improvement in how they felt about themselves, but 30% saw their trait shame increase. So I think we need to be monitoring this quite closely and understand the role that shame plays and how it's affected by psychedelics. And another area I would like to touch is how the psychedelic community responds to people who have had adverse effects and or people who've had challenging experiences. So some of you may have read about the recent case of a person very severely affected, and as a result there will be lifelong consequences for this person, and how a part of the psychedelic community responded in a way that's very toxic, recreating victim blaming and victim shaming attitudes seen in society. But I'd also like to highlight some really well-intended messages that are very common. Things like, it was a set setting, you just, you didn't look to that carefully enough, or there's no such thing as a bad trip, or you didn't get what you wanted, but you got what you needed, and you need to go back and have some more or some less or in different settings. So survivors have very often been told that they are to blame for their experiences. Their experiences have been invalidated, they've been shamed about them, they've been gaslighted. So these messages don't have this intention, but they come into the context of these people's lives in perhaps this particular way. So we need to be very careful that our messages are not, your suffering is your own fault, because it can't possibly be the psychedelics. And of course, we need to consider, as we do in every helping profession, when we are working with trauma, we are also vicariously exposed to that. So people working in the field would need to have a lot of support and trauma-informed clinical supervision and reflective spaces. So where do we go from here? Well, the first thing would be to reduce the shame. And that would involve committing to an honest validation of everyone's experiences, not only the ones that fit into our preferred narratives. And that involves actively maximizing all the different voices. And I'm also suggesting that we need to empower the person that is on a healing journey and not the literally awesome psychedelic and compounds. So these are the first of a very long list of things that we would need to consider if we were developing a trauma-informed psychedelic provision. I'm not going to go into that, but I would like to highlight that gender responsiveness is a core element of trauma-informed practice. And to wrap up, pretty much where I started, trauma-informed practice is survivor-led practice. It's not business as usual with a little bit of trauma awareness on top of it. It is about coming from a place of humility and genuine willingness to collaborate and share power. So in a trauma-informed provision, the people who have lived experience are the experts. People who've experienced trauma and who have experienced psychedelics would be at the best place to review and advise on what the physical environments would look like, the processes, the procedures, the language used, the messages. They could be involved in recruiting and training practitioners, and yes, I will dare say it, also co-design clinical trials. And that's all for me. Thank you.
Thank you, Eva. Amazing presentation and a very important topic. And now we have plenty of time for questions. Here we go first.
Thank you for the presentation. Would you comment on the viewpoint that beyond anecdotes, there's no real scientific evidence of our bodies being able to store trauma?
Sorry?
The viewpoint that beyond anecdotes, there's no real scientific evidence of our bodies being able to store trauma.
Store trauma physically, you mean?
Yeah.
The body? I think there's quite a bit of evidence for that in terms of how trauma affects the, if there is toxic stress and that is held in the body for a long time, that causes chronic inflammations that in their turn can cause chronic pain and chronic health conditions. So I would refer you to the surveys, because they were not research initially, the original A studies in the 90s, 95 to 97, that have been recreated about 200 times across the world. And they show with experiences and autoimmune and chronic illnesses, chronic pain, and a number of other health conditions. So this was fairly new back then, and it takes time for it to be kind of understood in medicine, for example. But it is becoming more and more knowledge that we do use and rely on.
Thank you. I have a question related to a phenomenon that we see in our, well, we have seen quite a lot in our clinical trial with psilocybin related to the to trauma, and some patients come to this therapy with the idea or with a firm belief that all suffering is caused by trauma. That psychedelics are the path to understand or to become aware of what that trauma even was, and then it can be kind of hard to work on relaxing that belief. And then people have experiences, and perhaps unsurprisingly, they quite often then have experiences that point to certain situations that may have been traumatic. And it's I have experienced it as a therapist as a difficult therapy situation, also as a stressor, also of course for the therapeutic relationship, to try to create caution as regard to those, or to encourage caution regarding those beliefs. And I often have seen myself or our team confronted with something that we have called the trauma industrial complex in psychedelics. Yeah, so retreat centers, people who write books, famous authors who spread these kinds of ideas, and it seems like a source of serious harm to patients and their families, their systems. And I was wondering if you would consider dealing with this problem a part of trauma-informed care.
You mean dealing with the expectations that are created?
Yes.
Yeah. I would say that starting from a place of compassion and understanding that people suffer, and of course they would be coming to any kind of therapeutic process to reduce that suffering. How much of the messages that are out there say that that can be a short journey, that it can be condensed, it can be one experience, or it can be a handful of sessions, then that's the responsibility I think we have as practitioners and professionals, to communicate very accurately, to give people the information they need. And from this perspective, it would also be to include survivors and ask them questions like, what would have been helpful for you to know before taking part in this trial, for example? What kind of information would you have liked to have? In what way would this information need to be communicated? At what point in time? From before you started showing an interest, early on, how many times would it need to be repeated and in what way? So we don't try to come up with all the answers ourselves. We allow people who have the knowledge and the wisdom because of their lived experience to advise and be part of these developments.
Yeah, thank you a lot. I completely sympathize your approach, trauma-informed. I still wonder whether there is a risk of overprotecting the patients, in the sense that, well, recovering from trauma might be quite difficult and require like going through really difficult emotional processes, and the shame and all the processes that you mentioned, which are of course like negative emotions. But don't you think that going through these emotions in a supportive environment with the help of a therapist could be like part of the healing process, that it could be harmful to be too protective with the patient?
Okay, so your question is whether it can be harmful.
Yes,
to be
whether you could
overprotective.
be too protective.
Yeah, I don't see this particular approach as being overprotective. I see it as being collaborative. And also this is working. This is a way of doing things, and it's a way of organizing services. It doesn't replace what would happen as part of that therapeutic process. I think that one of the misunderstandings about trauma-informed practice is that it's very soft, it has no boundaries, it's all very cuddly, but actually a lot of it is about clarity, transparency, accountability, and boundaries, like boundaries that are very clearly stated and they are very proactively agreed. So thank you for raising that, because I think that that's one of the misunderstandings around this approach.
Yeah, thank you, Eva. Amazing presentation.